and ear discharge could be from the due to the external ear abnormality or the middle ear abnormality. So when we deal with external ear abnormalities, the DDs could be the diffuse otitis media or the malignant otitis media, or there might be a condition which is known as otitis externa hemorrhagica, in which the hemorrhagic bulla would be formed in the tympanic membrane due to the viral or the influenza epidemics, or it could also be due to the cellulitis or perichondritis, furunculosis. So furunculosis is the Staph aureus infection of the ear follicles, and it occurs in the cartilaginous part of the external acoustic meatus only. The another thing is there might be the black debris on the examination, and it is specially due to the otomycosis. Otomycosis is the fungal infection of the external ear, or it could be due to the herpes zoster, and the term given is herpes zoster orticus. uh, there might be the dermatological conditions like seborrheic otitis externa or the eczematous otitis externa. Now, let's discuss some of the middle ear abnormalities. So, there might be acute otitis media, and if the duration is less than 3 weeks, then we state it as the acute otitis media. It could be subacute, that is 3 weeks to 3 months, and if it is greater than 3 months, we label it as chronic otitis media. And there might be otitis media with the effusion as well, which causes the ear discharge. And there might be chronic otitis media, squamous or the mucosal type. However, in the squamous type, the discharge would be scanty, and it would be purulent, whereas in the case of mucosal, it would be and profuse and mucopurulent. Or it could be the ear discharge might also occur due to the tympanic membrane perforation, and this can be secondary to the uh, chronic otitis media or the perforation. There might be CSF rhinorrhea and several causes, which are the miscellaneous causes for the ear discharge. Now let's talk about the otalgia. Okay, the patient might just present with the ear pain, and it could occur after the event like swimming or after trauma, or if the patient has a habit of ear pricking, or he has recently suffered from upper respiratory tract infection, or he is involved in the activities like scuba diving or skydiving due to the barotrauma as well. Now, the otalgia can, firstly, let's talk about the referred pain, which is not due to the condition in the ear. So, since the nerve supply is common for the vagus nerve, the trigeminal nerve, and for glossopharyngeal nerve, that's why the pain in the teeth can be referred to the ear, and it is due to the cranial nerve 5, and it can also be referred from the tonsils due to the glossopharyngeal nerve, or it could occur due to the radiation from the temporomandibular joints through the fifth cranial nerve, or it could be due to the tumors in tonsils or base of the tongue, hypopharynx and larynx as well. Now let's talk about the causes of the ear pain due to the abnormalities in ear itself. So if it can further be classified into the outer ear and middle ear. So the causes for the outer ear could be the acute otitis externa, which could be due to the impacted wax or the furuncle or otomycosis, as well as the malignant otitis externa. There can be herpes zoster orticus, or it could be due to the middle ear abnormalities like the acute otitis media or barotrauma, acute mastoiditis, or carcinoma of the middle ear. Now let's talk about the hearing, another symptom, that is hearing loss. It could be conductive or sensory neural or mixed kind. The conductive is due to the external as well as middle ear, and the sensory neural is due to the inner ear abnormalities. When we talk about the conductive hearing loss, it can be insidious onset, or it could be like sudden onset as well. So The insidious onset of the conductive hearing loss is due to the COM, that is chronic otitis media, or otosclerosis, or impacted wax, or the otitis media with the effusion. Whereas if we talk about the sudden kind of the hearing loss, then it has to be due to the acute causes, right? So acute otitis media can be one of the reason, or it could be due to the perforations of the TM as well. Now, sensory neural hearing loss, the insidious origin would be like presbyacusis, or the long exposure to the industry noise. The acute kind could be due to the labyrinthitis, certain kind of infection, blast injury, head injuries, or Meniere's disease as well, and acute acoustic trauma, or the intake of the autotoxic drugs as well. So why is let's continue with the hearing loss. So why is important in the history of the hearing loss? Like, there are a lot of diseases which are common in the childhood, that is acute otitis media and the otitis media with effusion, or the hearing lost after the infection with mumps or meningitis, is also common in childhood. Otosclerosis, which is a bilateral conductive hearing loss, is seen in the case of the young adults, and presbyocusis is seen after the age of 40 to 45 years. Uh, Now, family history is important because otosclerosis and the hereditary sensory neural hearing loss is associated with it. Hearing loss, the progression of the hearing loss, uh, it may be progressive if it is associated with a mucosal chronic otitis media, and it might be it might be stable in the case of the perforated tympanic membrane after a certain kind of trauma or the COM. So that brings us to the end of the uh, hearing loss. So let's talk about the vertigo now. So vertigo might be present with the central injuries or the peripheral causes as well. So, and it can be rotatory or the non-rotatory, and it's a sudden onset, then it is due to the oral origin. It might be episodic as well as continuous. So for the DDs, for the episodic kind of the vertigo, is Meniere's disease and BPPV, that is benign paroxysmal positional vertigo. Again, how to differentiate between the the Meniere's and the BPPV? The Meniere's would be associated would last for 24 minutes to 24 hours, whereas BPPV um, would be lasting for only few seconds, and there might be a lot of episodes in a particular day. When we talk about the continuous kind of the vertigo, it can be associated with acute labyrinthitis or the vestibular neuritis as well. And in both of them, it would last for like several days only. So let's talk about tinnitus now. So if there is any kind of sound that is continuously heard in the absence of the external sound, then it is known as the tinnitus, and it is specially associated with the inner ear disease. Now, in the hearing loss, it's important that we know about the AOM and the COM, and these come with the complication. That's why whenever we take the history for AOM and COM, then we have to ask about certain symptoms, that is severe or deep-seated headache with high-grade fever. Okay, so deep-seated headache might be due to the increased intracranial pressure, and these things should be asked. It might be associated with a vertigo due to the labyrinthitis, or it might be associated with the mastoid swelling as well, which is due to the mastoiditis or the abscess in the mastoid region. And we have to ask for the facial symmetry, because the facial nerve paralysis is also very much associated with AOM and the COM. That brings us to the end of this video. Thank you.